Hello friends, welcome to our YouTube channel for nurses preparation. I am Neeraj Kumar Kaithal. Today we are presenting few important points for upcoming Aims norcet exam 2021. In our today's video, we have collected the points from the cardiovascular system. So friends, please click upon the subscribe button and please like this video. Let's begin our today's video. Heart's outermost layer is epicardium. Heart's outermost layer is epicardium. Epicardium is made up of squamous epithelial cells. Squamous epithelial cells made the epicardium layer. Epicardium is the outermost layer that covers the heart and it is made by the squamous epithelial cells. Next point. Myocardium, heart's middle wall, made most of the heart wall. Myocardium layer is a middle layer of heart and it made most part of the heart wall. Next, inner layer of heart is endocardium by endothelial tissue. Heart's inner layer of heart is endocardium layer and this layer is made up of endothelial tissue. Remember with the name endocardium made by endothelial tissue. Next, pericardium have two layers. Pericardium layer covers the heart and it is made up of two layers, parietal and visceral layer. We can call it as parietal pericardium and visceral pericardium layer. It is the layer that found just beneath the epicardium. Now let's talk about few important points. First, pulmonic sound auscultated at left second intercostal space in mid-clavicular line. Intercostal space. Costal means ribs. Space between two ribs known as intercostal space. Space between two ribs. This is the rib, this is the rib. The space found between these two ribs are known as intercostal space. Mid-clavicular line. This is the clavicle bone. It is also known as puty bone. Its mid part. Draw a imaginary line. This is a mid-clavicular line. Now, if we want to hear pulmonic sound, we have to auscultate with the stethoscope at second intercostal space in mid-clavicular line. Next point. Abnormality of the pulmonic valve are auscultated left second intercostal space along left sternal border. Sternal border. This is the bone known as sternum. This is also called breastbone. Its left lateral part, this border is known as left sternal border. If a person is having pulmonic valve abnormality, in this condition we hear the sound at second intercostal space along with the left sternal border. In normal cases, we are hearing the sound at second intercostal space and just upon the mid-clavicular line, but in pulmonic valve abnormality condition, we are hearing this sound just near to the left sternal border. Next point. Aerotic valve abnormalities are heard at second intercostal to the right of the sternum. Aerotic valve abnormalities are heard at second intercostal space to the right of the sternum bone. Next point. Mitral valve abnormalities are heard fifth intercostal space in mid-clavicular line. In case of mitral valve abnormalities, mitral valve are the bicuspid valve that are found in left atrium and between left ventricle. Mitral valve is a bicuspid valve that found between the left atrium and left ventricle. If they have abnormalities, we can hear its sound at second intercostal space right to the sternum bone. Next point is tricuspid valve abnormalities are heard at third and fourth intercostal space along the sternal border. Tricuspid valve are found in the heart's right atrium and right ventricle. Tricuspid valve found between the right atrium and right ventricle of the heart. If the tricuspid valve have abnormalities, so the sound is generated by this valve are heard at third and fourth intercostal along with the sternal border. Next point. Aerotic valve malfunction is heard as murmur sound. When we auscultate person's heart, if the murmur sound is coming, we can say the person may have aerotic valve malfunction, because in the case of aerotic valve malfunction, murmur sound is produced by the heart. Troponin I level can be detectable 1 hour after myocardial injury. If a person is having myocardial injury such as myocardial infarction, due to the damaged myocardial tissues, the body secretes troponin I. Troponin I's level increases very rapidly. We can detect this in blood after 1 hour of myocardial injury, and this is the best indicator to finalize the diagnosis of myocardial injury or myocardial infarction. Lactate dehydrogenase isoenzyme can be used in the diagnosis of cardiac injury. To diagnose the cardiac injury, we can also use lactate dehydrogenase isoenzyme. Next point. Systemic hypertension or increased atrial contraction can cause fourth heart sound. In our body, with the help of stethoscope, we can only hear S1 and S2 or first and second heart sound, but in case of systemic hypertension or increased atrial contraction, fourth heart sound is produced. This third and fourth are the abnormal heart sounds. Left ventricle of the heart pumps blood to the aorta. Left ventricle pumps blood in the aorta, and the aorta supply the blood in whole body. Next, anterior wall myocardial infarction can cause decreased left ventricular function. Anterior wall MI. This is the most common side of myocardial infarction. If the myocardial infarction occurs in the anterior wall of the heart, this can cause left ventricular function decrease. Next point. In left side heart failure, fluid accumulates in the interstitial and alveolar space in the lungs, and that causes crackle sound. If a person is having left-sided heart failure, in this situation, fluid accumulates in the lungs, and due to this, crackle sounds are present. So, it can be asked in the exam, what are the reason in which crackle sounds are present? So, you can say due to the accumulation of the fluid in the lungs, crackle sounds are present, and this shows left side heart failure. Next point. Pulmonic and tricuspid valve malfunctioning causes right-sided heart failure. Right-sided heart failure can be occur due to pulmonic and tricuspid valve malfunctioning. Next point. Arrhythmias is the most common complication of myocardial infarction. Due to oxygen decreased supply, arrhythmias are caused in the person who is having myocardial infarction. So we can say arrhythmias are the most common complication in case of myocardial infarction. Second most common complication is heart failure. Second most common complication in MI is heart failure. First is arrhythmias. Next point, pericarditis. Most common cause is bacterial or viral infection, but may also occur after myocardial infarction. Pericarditis is an inflammation of the pericardium layer. Pericardium is a sac-like structure that surrounds the heart. If the inflammation occurs in this pericardium layer, it is known as pericarditis condition. Most common cause of pericarditis is bacterial and viral infection, but this pericarditis condition may occur after myocardial infarction. So friends, this is our today's video. How was the video? Please give your feedback in comment section and subscribe our YouTube channel for nurses preparation for regular videos for upcoming Aims norcet exam 2021. Please click upon the like button if you think this video was helpful. Thanks for watching. All the best.